So good afternoon, everyone. My name is Kate. As Natasha mentioned, I'm a research assistant with Generation Victoria, or GenV. And before I begin today, I just want to acknowledge the traditional owners of the countries participating in this meeting. I am presenting from the lands of the Bunurong people of the Kulin Nation, and I pay my respects to elders past and present and any First Nations peoples joining us online today. So I'm going to be speaking on behalf of the team about GenV's consumer engagement, in particular, the GenV Participant Advisory Panel. For those that are not familiar, GenV is a large birth cohort, birth and parent cohort, and we have a statewide cohort that is open to all Victorian children born between the 4th of October 2021 to 2023 and their parents and guardians. So to date, we have more than 123,000 participants taking part in GenV, and that includes over 49,000 children. By design, GenV is a highly inclusive cohort. So we have families taking part across the state, including over 27,000 in regional Victoria, more than 7,500 families whose primary spoken language at home is not English, more than 850 parents who identify as First Nations, and more than 33,800 participants who are most or second most disadvantaged. There are many components that make up GenV. This slide just provides a simplified overview, but by bringing together a large and inclusive statewide cohort with consent, participant measures and biosamples, alongside national data assets, GenV can create a platform that supports discovery and interventional research with an overarching aim to help solve complex problems by 2035. I'm very pleased to be speaking today as a part of the consumer engagement session. I think this audience is very well aware of the important role and the value that consumers bring to research. In particular, I'm going to be speaking to consumer involvement, or patient and public involvement, PPI, being where research is carried out with consumers. And so this can take many forms, and suitability can vary depending on the type of research. So today I'm providing an example of PPI at scale in a large cohort such as GenV. Before I start speaking about the Participant Advisory Panel, I wanted to acknowledge the other involvement activities that have been conducted. This slide just shows you some key activities across the last 5 years. So in the blue, you can see various consultations and focus groups with existing and expecting parents during the early design and implementation of GenV. In the orange, there's also knowledge sharing activities and learnings that we have taken from other longitudinal studies, both locally at the Melbourne Children's Campus, as well as globally. We're also very lucky to have a GenV Vanguard cohort, which precedes and continues to inform the implementation of the statewide cohort of GenV. And since commencement of the study, we have always been guided by participant feedback on various areas of GenV. So in January of 2023, we established the GenV Participant Advisory Panel as a mechanism for participants to provide input into design, implementation and outcomes for GenV. The decision to implement a panel for GenV was considered based on the scale and the diversity of our study. Having a panel has allowed us to capture the views of all GenV parents that are interested in taking part in how the study is being run. There's various reasons why participants wanted to take part in the panel, and motivations include things such as to help GenV be the best that it can be, to be involved in how research like GenV is done, and to make sure GenV families have a good experience with the study. So how does the panel work? Panel membership is voluntary. Parents can sign up via our GenV communications. This primarily includes our GenV and Me surveys and our newsletters. To date, we have 1,181 members in the panel, and panel members can cease their involvement at any time, separate to their participation in the main study. Panel activities are also voluntary. Members receive their first step registration, and then subsequent activities delivered in waves. The panel has been intended to be low burden, and this is in alignment with our principles for participation in GenV. However, it has also been designed to enable focus groups and interviews in addition to brief polls and surveys. So at registration, we do ask participants how they would like to be involved with GenV, in addition to surveys, As you can see, 30 to 50% of panel members are interested in interviews and focus groups with a preference for online, and about 45% prefer to make decisions on involvement at the time that the activity is delivered to them. This is a very busy slide and I won't touch on everything, but just to note that we do collect demographic data at registration for the panel. This enables us to understand how the representation of the panel matches with the GenV cohort. And it also allows us to consider subgroup analysis where it might be appropriate. We are very grateful to have a variety of members in our panel. There's a few areas I will touch on with respect to representation. You can see we have a larger proportion of mothers and women in the panel, a larger proportion of parents with Anglo-Celtic and European ethnicities, and a larger majority of English-speaking panel members. And this is primarily due to the fact that the panel to date has been in English, with plans now to translate. Finally, we also have a larger majority of panel members that have a postgraduate and undergraduate degree level of education, with less so at certificate, diploma, trade and apprenticeship, and no further education post-high school. Now I'm going to speak to some of the main activities that we have conducted with the panel. This was the very first activity led by our cohort design lead, Dr. Libby Hughes, alongside William Sierra and our scientific director, Professor Melissa Wake. And this survey assessed parents' experiences of recruitment to GenV, their expectations and preferences for participation, and their ongoing information needs. The findings showed that overall panel members had a positive experience with joining GenV, that they felt their recruitment and information needs were met, and they had good recollection and positive attitudes toward GenV elements. It was also an opportunity to share their preferences for ongoing management of participation, and this explored areas such as dynamic consent, survey frequency and length, and communication types. And together, these findings have been very helpful for us to develop our materials, ongoing, adapt our communications for the cohort, consider our ongoing planning and design of the study, and improving our participant experience, engagement and retention. Another activity we've conducted was led by Associate Professor Dania Veers and Dr. Fiona Lynch at the Biomedical Ethics Group at MCRI. And this looked at exploring the perspectives of parents on return of findings for themselves and their children. In particular, looking at willingness to have DNA tested for themselves and their children, willingness to give a blood sample for testing, and interest in the concept of return of findings for themselves and their child. These have been really helpful for us to understand parents' views about genomic testing and return of results in research in general, as well as understanding differences and preferences for parents versus their children, and may be useful for the future when we're considering an approach to genomic testing for GenV. A more recent activity we've led is the involvement of decisions about GenV data. This was a collaboration with Dr. Jessica Bell in the UK from the University of Warwick. And this looked to understand parents' views around management and decisions on how data are used for research. So considering preferences from parents on who would be involved in decisions about data and how it is used, interest to be involved themselves in decisions about data, and how they would like this to happen and to what level, as well as exploring thoughts about new ideas for managing research data. So the concept of data trusts for health research, particularly longitudinal research studies, as well as novel data types such as wearables. And this was quite a recent activity, so we are hoping the data will help us to explore approaches for management of GenV, as well as other health research data, and consider ways that we can embed participant values in data use. My last couple of slides, I would like to address some practical considerations about having a participant advisory panel in a large-scale study like GenV. We're very lucky to have such a wide group of interested parents that provide valuable and prompt insights into the running of GenV. The panel has allowed us to have more diversity in our membership than perhaps we would have had with a smaller scale consumer involvement approach. And this lends itself to enabling comparative subgroups and understanding how parent views might differ depending on their backgrounds and their lived experiences. The panel also enables varied involvement opportunities. This means that panel members can choose how they wish to be involved and to what extent. And by capturing their preferences, we can offer different types of activities, including those that are low burden for our busy families and parents taking part in GenV. Some of the challenges that we have experienced, for example, representation. we do acknowledge that the panel has some demographic differences to the main cohort and perhaps represents more of our active and engaged participants compared to our disengaged cohorts. As with all consumer engagement approaches, it's also important that the involvement is meaningful. And given the scale of GenV and the panel itself, it's been very important that we ensure that our panel activities are accessible to the parents and can be feasibly implemented at scale. We also have the complexity of retest bias, for example, with survey assessments, where these panel members are still active participants in the study themselves. But we are very lucky, therefore, to have our GenV Vanguard and early recruited families to assist. In terms of future plans, we're looking to translate into top 6 languages, as well as consider some targeted involvement strategies to improve our representation and enable voice for certain subgroups of parents. And given we're a births cohort study, of course, we're interested in the involvement of GenV children down the line. Next steps for now, we're also continuing to implement the new findings from the panel, as well as introducing new activities to support the continuation of GenV, including different types of activities such as focus groups. I would like to thank you all for giving me the opportunity to speak today and acknowledge all of our GenV panel members and participants for their generosity and contributions, as well as the GenV team, collaborators and partners for helping to make this work possible. Thank you.